close to midnight. Something evil's lurking in the... Okay, a little thriller, because what's scarier than the lecture on malpractice and risk management? This is not a topic that anyone likes to think about. Hopefully something that we can give you the tools you need to avoid having to deal with this down the road. But things being what they are, sometimes the worst happens, and so we also want to give you some tools to deal with it if you find yourself in a situation where you may be involved in some risk. So here we go. And first, what are you going to ask yourself if you hear that you are involved in a case that is now becoming some sort of malpractice suit? The response is always, why? Why did this happen? Sometimes the case had no red flags at the time. And then, why me? This can't be happening to me. People feel shock, disbelief. They feel like they're too young, or maybe that they're too experienced. They may feel like this is going to be the end of their career. And often they feel like they didn't do anything wrong. The process of being involved in a lawsuit is an emotional roller coaster often for people. Being in the courtroom is very different than being in a clinic or hospital situation. And it affects how you continue to practice, your ability to focus. People worry how their coworkers are going to feel about them, and of course, how are you going to react when you see the patient again? So, what are the reasons that PAs are sued? Typically, it is due to one of these 6 reasons: a lack of adequate supervision, which can be guarded against by documenting in your chart note if you discuss the case with a supervising physician or a consultant. You can put right in your chart notes, in consultation with Dr. X, the following plan was discussed, or we reviewed this x-ray. Untimely referral could be referring patient to the ER, referring patient to specialty care. Failure to diagnose can be due to misinterpreted information, like missing something on an x-ray. Could be lacking the skills needed to diagnose, or something outside of your area of expertise. Oftentimes it may be that there was an atypical presentation and it just wasn't caught. Inadequate examination, not using all of the skills that you are currently learning: inspection, auscultation, palpation, percussion. Lack of documentation. If someone read your chart notes, would they get an accurate picture of the care that you provided? If you didn't document it, then often in the eyes of the law, you didn't do it. Lack of communication can be communicating with supervising physicians, other members of the healthcare team, or the patient and family. So, keys to risk management: document, document, document. Make sure you keep careful notes on everything you do. Maintain patient confidentiality and your professionalism. And employ effective communication strategies. So make sure when you are with the patient that you are giving the patient all of your attention. You're closing the door. You're not bringing your cell phone in unless there is an emergency situation. That you're spending that time being with and listening to that patient and treating that patient with respect. And don't overpromise. Don't tell them that you'll call them tomorrow with the lab results if they may not be back for 3 days. Give them realistic expectations of what you can do. There have been some studies that show that spending 18 minutes rather than 15 minutes in the room with a patient correlates with less likelihood of being sued. Just taking that little extra time. And then also carefully explaining everything that you're going to do before you do it. So discovery. In legal terms, the statute of limitations on a case, that time doesn't begin until the occurrence of the event puts the plaintiff on notice. So when the person who knows that the error has occurred, and I'll give an example of that in just a moment. But the average claim takes 22 months to report and about 34 months to resolve. So that's a 55-month roller coaster on average. So for example, if a surgeon left a clip inside a patient's chest and it isn't found until after that patient dies 7 years later and an autopsy is done, and then they look back and find in the record that the patient had been complaining of chest pain throughout the time, but never had a chest x-ray to find the clip. So the statute of limitations begins when that family is informed of the autopsy results and knows that the error occurred. They can't go back and say, oh, it's already 7 years have passed, because the plaintiff didn't have any way of knowing that that error had occurred prior to that. External occurs when the standard of care is something on a national level. So that a pap smear is interpreted according to the American College of Gynecology or some other national accrediting body. Causation is how a provider is shown to be negligent and that it caused injury or was a reasonably close connection to injury that occurred. And then the damages can fall into multiple categories: death, disability, deformity, medical expenses, lost wages, out-of-pocket expenses, more intangible things like pain and suffering or emotional distress, and then punitive damages are if cases of fraudulence or malicious damage. So some malpractice facts. There was a study of data from 1991 to 2007 looking at the overall incidence and ratio of malpractice claims per provider, and there was no difference really between PAs and APNs than there was for physicians over that period. The average and median malpractice payments of PAs were less generally than those of physicians, while that of advanced practice nurses were greater. And the trend in payment increases was less for PAs than physicians, advanced practice nurses, and higher for APNs than for physicians. The cost of malpractice for PAs did not go against their general cost effectiveness. And the rate of malpractice incidents increased for PAs and APNs over the studied period, but remained steady for physicians. The reasons for disciplinary actions were similar among all groups.